Hi, I'm Jamie Levine, and it's an honor that I was asked to discuss this article on free flap reconstruction of posterior trunk soft tissue defects, a single institutional experience, and systematic literature review. I myself have over 20 years of clinical microsurgical experience, and I've only faced these type of reconstructions and these type of defects less than 10 times. For these reasons, it is very useful to have a review article that provides a large institution's experience over time. Within this article, the MD Anderson group also provides an algorithm based on the location of the defect and what options you have when performing reconstruction in these zones. They also do a good job discussing the management of these patients both intraoperatively and postoperatively. I think this is all very useful. Although this article is retrospective, it still provides very useful information clinically for the reader. To enhance the power of the article and to provide an understanding of the complexity of this type of reconstruction, they did a literature review and meta-analysis. The MD Anderson review itself looked at their experience between 1990 and 2019, and this yielded a total of 26 patients. This actually makes the MD Anderson findings the largest in the current literature. This in itself shows the rarity of this problem and this type of reconstruction. Because of the difficult locations of these defects, vein grafting often becomes a necessity. These vein grafts can be performed as either direct arterial and venous connections, or they can be performed in a delayed fashion. This is an extremely interesting and important topic that is explored within this article, and is another reason why I'm very happy that this type of paper is being published. I think it is important for the reader to know that sometimes certain wounds, especially in this area, will require an extreme type of reconstruction, and that local tissues and local vasculature just won't suffice in providing the type of reconstruction that is necessary for this problem. Another point that was shown both in the literature review and their own retrospective review is the high complication rate. In their own analysis, they had over 30% major complication rate and over 8% flap failure. I don't look at this as a criticism. I look at this actually as a statement of the complexity of the type of reconstruction that is needed for these really complex and difficult type of defects. As stated earlier, the MD Anderson group created an algorithm for treatment of defects in these areas. I myself am not usually big on algorithms, but unlike other algorithms, theirs is mainly suggestive and gives recommendations based off of the zone of injury. It also gives locations for vascular supply that can be used when performing some of these reconstructions. I think this is very helpful for the surgeon who is faced with these problems and in deciding their vascular approach prior to entering the operating room.